Lack of communication is a big problem in healthcare, and the quality of that communication often changes depending on where you receive care. Now, if that does not concern you, then I don't know what to tell you because your diagnosis should not determine whether you're heard, and your insurance should not determine whether someone responds. And the type of practice you visit should not determine whether your questions get answered. And I bet you probably experienced that, right? So today, I want to talk about something I've noticed throughout my own healthcare journey. Now, disclaimer, this is my experience and it may not be yours, but I think this is a conversation worth having. So throughout my healthcare journey, I've received care in multiple settings. And what does that mean? I'm talking about private practices, academic medical centers, large hospital systems, teaching hospitals, transplant centers, specialty clinics, and the whole gamut, urgent care. Um, and I've noticed a few things, and I've noticed the quality of communication. I've noticed the communication in several private practices, and the appointments usually go well, and physicians spend some quality time with me, and they answer my questions, and sure, they care. And the problem starts when I leave because that's when communication can sometimes be difficult. And I'm talking about phone calls and messages, the portal and emails. And, that silence can last for days, and in some of my cases, even weeks. And, that uncertainty creates anxiety, right? Um, and that creates anxiety because I don't know whether anyone's listening. I don't think that I'm being heard. Okay. So what I want to do now is compare that to many of my experiences within larger academic health systems, right? And I'm talking about the teaching hospitals and the integrated hospital networks, and the transplant centers. Now, remember, this is a disclaimer. This is just my experience. And in those type of environments, the communication is a bit different. Portal messages receive responses, either a nurse or a coordinator follows up, but my questions get acknowledged. Now, sometimes the physician responds, sometimes they don't, but at least I get a response. And, that makes me feel good because it tells me that my message was seen and that they're working on it and that I'm not forgotten, right? And just those small gestures, help reduce anxiety by so much. Okay. Now, this is not to say that one physician cares more than the other or that private practice physicians are worse. No, there are some excellent private practice physicians out there, some extraordinary ones. And listen, there are hospital systems out there that struggle too. And it's not about a matter of caring. We're talking about the infrastructure, okay? And let's think about the private physicians, the private care physicians, right? Usually they wear so many hats, right? They see patients and they're running a business, managing staff, handling the insurance, and signing off on the prescriptions, and reviewing labs, and returning phone calls, and just they're doing the whole gamut, right? And then with hospital systems, like academic centers and so forth, there's actually nurse navigators or care coordinators, medical assistants, residents resident physicians and fellows and patient communication teams and call centers and shared inboxes. And, at these teaching hospitals, uh, there, there's usually a multiple layer of clinicians that support patient communication, such as, like I mentioned before, the residents and the fellows, the attending physicians, the nurses and coordinators. And, having that team-based structure can make it easier for someone to acknowledge your questions, you know? And as a result, you may experience communication very differently. And communication is not a luxury, okay? Communication is healthcare. So imagine you're receiving some abnormal labs, all right? You send a message to your medical team, crickets, and days pass. Hopefully a week doesn't pass. But if that happens, you're anxious, right? You're like, oh my, okay. So does this mean I'm dying? Or everything's okay? I'm not hearing anything. So you schedule that hot date with Dr. Google, right? And, I've had discussions about Dr. Google before because it's so broad. And depending on your findings, your anxiety may grow and you may lose sleep. And, all of this could be a result of the fact that no one has actually said to you, we received your message. Okay. Now, there have been times where I've reached out repeatedly. I've had one recently where I reached out to a medical team regarding, I was on a course of antibiotics for a UTI, and those antibiotics, actually, so my bacteria was resistant to those antibiotics. And so I needed another course of a stronger antibiotic. And I called, sent me to voicemail, call could not be completed as dialed. So I sent portal messages, I sent emails, I actually sent text messages, and I waited and I followed up. I'm still waiting. 3 days passed, 5 days, a week passed, right? And as someone living with chronic illness, this isn't a matter of casual questions, This is, a matter about my medication and my health and my lab results and my symptoms. And, every day without this communication, it feels longer and my anxiety grows. But ultimately, what I ended up doing was communicating with my primary care physician, and I was able to get the treatment that I needed. And the physician in which I initially consulted with regarding my care and my lab results didn't get back to me until 10 days later. Mind you, I had already started the second course of treatment, but can you imagine waiting for an additional 10 days, still feeling the results of my UTI? So, yeah, that doesn't feel good. And so, what I would want you to do when you're seeing these doctors, so let's think about some strategies here. So instead of simply saying, my doctor doesn't call, what I want you to do is during your appointment, I want you to ask, if I have questions afterward, what's the fastest way to reach someone? Okay, please ask that, and ask who covers the messages when your physician isn't available, and, find out whether it's nurses who monitor the portal, if the portal is even being monitored, and ask expected response times, all right? And, just be concise with that communication and lead with your questions. And I want you to include, when you're reaching out, I want you to include dates and symptoms, any medical changes, and include the urgency. And, by providing that information, this helps your team help you. Okay? So communication doesn't always require longer appointments, you know. It's just a matter of better systems and automatic acknowledgments and expected response times, right? And you know, even a message saying that, hey, and I'm talking to you via the practices. It's just a matter of closing those communication loops. And if you just send a message saying, hey, we received your question, and a member of our team will respond within X business days, like 2 to 3 or 3 to 5 business days, that dramatically reduces patient anxiety. Okay. And one of the reasons why I built Alvora Health is because I recognize that many of you leave your appointments with questions, and those questions don't always get answered quickly. In real talk, that waiting period can feel overwhelming. And I wanted you to have a healthcare clarity companion. And just remember, I didn't build this to replace your physician, and it's not a diagnosis engine. This is a place for you to better understand your lab reports and prepare questions and walk into these conversations with your medical team feeling informed rather than overwhelmed. So, in conclusion, healthcare communication it shouldn't depend on luck, right? And it shouldn't depend on which building you walked into or whether your physician happens to have 5 minutes between patients, because you deserve consistency and you deserve acknowledgement and you deserve clarity. And sure, most healthcare professionals that I've worked with have wanted what's best for me. And it's not about compassion, right? It's about the capacity and the workflow. And, the healthcare system really wasn't built to communicate as well as it delivers care. And that's a gap that we're working to improve because I believe that improving communication is one of the most powerful ways to improve healthcare itself. Yeah. So if you ever opened a patient portal and you looked at your lab results and you wish someone could just explain what those results mean, I created something to help. So I want you to download my free Clear Lab guide below using the link in the description. And inside, you'll learn about the 12 most common lab tests that are ordered during routine care and what each one measures and why your provider ordered it and how to better understand your results before your next appointment. Because better conversations start with better understanding. And remember that better clarity leads to better understanding.